Hello Ali, how are you doing? It's been a while since I last met you.
Hi Epul, I'm fine. I heard you were admitted to the hospital last month. That's why I called today. How are you doing right now?
Not so good lah Ali. Actually, I'm a bit shy about this, but since you are my friend, I will tell you the truth. Actually, I cannot control my urination anymore after I did my prostate surgery. Now, I have to wear pampers only. But the doctor said that it may improve after some time. Hopefully, he is right. Fortunately, he said my cancer is detected at an early stage, so I have a very high chance of cure.
Oh no Epul, I am so sorry to hear that. But the doctor should be right? You will recover. Don't worry. How do you know that you had cancer Epul?
At first, I was having difficulty to pass urine, and this happened for a while actually. I was so worried, so I went for checkup at Klinik Kesihatan Gerintau.
Oh, and then what did they do for you?
At the hospital K, the doctor examined me and did some blood tests. After that, he said that I might have a prostate cancer and he referred me to the specialist at the Ipoh General Hospital. After that, I think at the hospital they took some tissue for examination and then they diagnosed with prostate cancer. Actually, I was so scared at that time that I could not sleep and eat anymore. But I was advised by the doctor to have an operation to remove my prostate, and I did the operation about 10 days ago.
Oh, so what about now? Is it become better?
Yes, I'm currently feeling better and on a follow-up at Hospital Raja Permaisuri Bainun. I'm so relieved that the cancer was at an early stage, unfortunately. The doctor told me that at our age, it is more likely to get cancer. Maybe Ali, you should go for a checkup too, I think.
Oh, I see. Thank you for telling me that. If that's so, I will go for a checkup lah. I hope things are good for you, Epul, and I pray for your speedy recovery.
Okay, Ali. Thank you. Bye. See
Bye
you again.
bye. All
Bye.
right. Bye.
Hello, Mr. Ali and Madam Halimah. Please have a seat.
Hello,
Hello,
doctor.
doctor.
Hello. Okay, so what's bringing you here today?
Actually, I came here because I am concerned of my health. Recently, my friend had prostate cancer, and also my late father passed away due to colon cancer. So I am worried that I might have cancer as I am getting older. And I heard that we can do blood tests to check for cancer. Is it true, doctor?
Okay, so I am sorry to hear that, Mr. Ali. So yes, we can do few blood tests for cancer screening because when we do the blood test, the result may show cancer cells and other substances that are made by the cancer. Before we proceed, can I ask both of you a few questions?
Sure, doctor.
Right. Okay, so Mr. Ali, do you have any medical illness before, such as diabetes mellitus, high blood pressure?
Um, no, doctor. I don't have any illness. Same goes to my wife.
Okay, so you mentioned just now that your father had passed away due to colon cancer, right? Okay, so is there any other of your family member having the same illness?
As far as I know, there is no one else in my family having cancer besides from my father.
Okay, Mr. Ali, I understand your concern, but don't worry. Not everyone with family history of cancer will get the disease. Other than that, may I ask, do you smoke?
Yes, doctor, I do smoke.
Right. May I know how long have you been smoking and how many cigarettes do you smoke per day?
I have been smoking for the past 30 years, but maybe around 10 cigarettes per day.
Okay. Sorry for asking this question. Do you drink alcohol?
Eh, of course, no lah, doctor.
Okay, that's good, Mr. Ali. Okay, how about you, Madam Halimah? Is there any of your family member having the same problem?
No, doctor. But both my father and my sister, they have diabetes mellitus.
Okay, Madam Halimah, I'll take note for that. Okay, so are you both still working right now?
No, doctor. I am a retired teacher now. My wife is a full-time housewife.
All right. Okay, so do both of you exercise at home?
Uh, no, doctor. But every evening, I would do some gardening at my house.
And as for me, doctor, I don't really go out and exercise because recently I feel very tired when I do my house chores.
Oh, I see. May I ask you, Madam Halimah, are you still having your menses?
No, doctor. It has been around 7 years since I stopped having my menses.
All right. Okay, so do you still remember at what age do you had your first menses?
First menses, I can't really remember, but I think it's around when I was 14 years old.
Okay, so now I would like to examine both of you. Is that okay?
Sure,
Sure,
doctor.
doctor.
All right. I will check your blood pressure and my nurse will measure your height and also your weight. Finally, I will take some blood for blood test for the lipid and blood sugar since Madam Halimah has a family history of diabetes mellitus, and it is also recommended to screen yearly for high blood cholesterol and also diabetes in people over 40 years old. This will help to assess your risk for heart disease. Okay?
Okay, doctor.
Okay.
All right. Okay, so we are done with the examination. All right, so I would like to address to both of you about few things. Okay, first of all, it is about your BMI, your body mass index. So, Mr. Ali, your BMI is 33, while Madam Halimah, your BMI is 28. These both of the results show that both of you have obesity.
BMI? Oh, what does that mean, doctor? Will it affect our health?
Yes, the normal range for BMI is normally 18 to 23. So when BMI is exceed 27, it is considered as obese. So both of you had exceed 27. So this could lead to many other illnesses such as diabetes, high blood pressure, and high cholesterol level, heart problem, and also cancer.
Oh no. So what should we do to prevent all of that, doctor?
All right. Okay. So you don't have to worry because there are many ways that you can do. What I can suggest you first, you can reduce your weight by modifying your lifestyle. All right. So in order to lose weight, you will need to increase physical activity. Approximately, you can do around 1 to 1.5 hours per day by doing moderate physical activity. Okay, you need to do it 5 times per week. This include strength training 2 to 3 times per week. Alright, okay, so I suggest you to start with fast walking first, and then you can increase the level by combining the jogging and also walking. Okay, so apart from that, you also need to monitor your daily calorie intake. You may practice reducing 500 calorie in your daily intake, which may help you to lose 0.5 kg in a week. Right. Okay, so other than that, you may follow the recommended quarter, half portion in every meal, which you should only take a quarter of carbohydrates, quarter of protein, and half portion of fruits and vegetables. Right. Okay, so yes, you also should reduce your intake of salt, oily food, and any food with high sugar. And then later, I will give you a pamphlet with the type of food that you can take or avoid. Is that okay?
Okay, doctor. So we will try to do that, and we will try to monitor our calorie intake.
Okay, so that's good, Madam Halimah. Alright. Okay, so next, I would like to ask Mr. Ali. Are you aware about the danger of smoking, Mr. Ali?
Actually, I know, doctor, and I'm aware of the danger and also the benefits of quitting smoking. However, doctor, uh, I I cannot bring myself to stop smoking actually.
I see. So have you tried to stop smoking before?
I have tried before, but it can only last for less than a week.
Okay, Mr. Ali, I advise you to try again to stop smoking this time. There are few ways to help you to stop smoking. Nowadays, there are medications that can help you to stop smoking. There are few studies that shown that the medication will give better result for people who wants to stop smoking. So, shall I refer you to the smoking cessation clinic, Mr. Ali?
Okay, doctor. Thank you, doctor. I will try my best this time.
Right. Okay, so now we will proceed to discuss about the cancer screening. We will start with Mr. Ali first, and then so should I proceed?
Okay, sure, doctor.
Right. So, Mr. Ali, do you experience problem with urination, such as changes in frequency or poor urine flow during urination? Or do you experience frequent urination at night? Or do you feel that you cannot empty your bladder completely? Do you feel any pain during the urinating? Do you experience any of those?
No, doctor. I think I don't experience any of those.
Right. Okay, so tell me what you know about prostate cancer, Mr. Ali.
Actually, doctor, I do not know much. I only know that the prostate cancer is a cancer of a male.
Okay, Mr. Ali. Since you do not experience any of the symptoms that I mentioned before, and you do not have family history of prostate cancer, so we do not routinely recommend prostate cancer screening for you. First, I would like to inform to you the benefit and harm of doing the prostate cancer screening. Then I will let you to decide whether you want to be screened for the prostate cancer or not. Alright? Okay, so the blood test called PSA, which is prostate specific antigen test, is used to screen for prostate cancer, which offer a small benefit of detecting early prostate cancer in some men, which it also can lead to effective treatment and prevent death. However, few studies have shown that the test has caused many men to experience the potential harm of the screening, including giving incorrect result that require additional testing and possible prostate biopsy. And also it can be overdiagnosis and overtreatment, and the treatment also can give complications such as incontinence and impotence. The test may be negative when the patient has cancer, causing misdiagnosis. Mr. Ali, you do have a higher risk for the prostate cancer due to smoking and increasing in age. So if you decide to get screened for prostate cancer, I would recommend to do both the blood test for prostate scientific antigen and a digital rectal examination for higher accuracy. Is it okay with you, Mr. Ali? Do you understand?
Okay, doctor, I understand.
Okay, so besides that, I would like to suggest you to do a screening test for colon cancer as you have a family history of cancer colon, which will increase the chance of you to getting it. Alright, okay, so for this screening, you may undergo a colonoscopy, and if the result is normal, it will be repeated for every 10 years. And at the same time, we recommend to check for stools for blood every 3 years. Madam Halimah, you should also be checked for colon cancer. You can have a stool examination for that. If the result is normal, you can repeat it every year.
Okay, doctor. So it means that it is advisable for me to screen for the colon cancer, right?
Yeah.
And then I have to decide whether I want to be screened for prostate cancer. Is that right, doctor?
Yes, Mr. Ali, that's right.
Um, then, doctor, I think I want to think about the blood test for prostate cancer, and can I let you know when I want to come again next time?
Sure, Mr. Ali. Okay, so Madam Halimah, have you had any mammogram, pap smear, or screening for colon cancer before?
No, doctor. I've had pap smear before, but I have never done the other test.
Alright. Okay, Madam Halimah, at your age now, it is advisable for you to be screened for these 3 cancers. For breast cancer screening, although I have examined your breast and they are fine clinically, I would suggest that you to do a mammogram. If it turn out fine, then to do it biennially. At the same time, it would be best for you to examine your own breast once every month. If you can feel any swelling or any of your breasts look unusual, please see a doctor soon for further examination.
Okay, doctor. But I don't know, how can I do the self-test examination?
Okay, my nurse will teach you how to do the breast self-examination later. When was the last time you did pap smear?
I'm not sure lah, doctor, but I think more than 10 years ago.
It is recommended do pap smear once in every 5 years. For traditional pap smear, 3 yearly. For every woman that is sexually active until 65 years, if the results are normal. So far, do you understand, Madam Halimah?
Yes, doctor, I understand.
Okay, so I will do the pap smear for Madam Halimah. Take your blood for blood test today and stool test. Then I shall set an appointment date for both of you to review the result. Alright, then I will refer Madam Halimah for a mammogram, Mr. Ali to the quit smoking clinic, and to the surgeon or gastroenterologist for colonoscopy. Is that okay?
Okay.
Yes, doctor.
And later, you will let me know your decision on the blood test for prostate cancer when you are ready, Mr. Ali.
Yes, doctor.
Alright. Is there anything else you want to clarify with me?
I think so far we understand, and we will follow your recommendation. Thank you so much, doctor, for your help.
Alright. Okay then, I'll see you guys on the next appointment, okay?
Okay, doctor.
Okay, doctor.
Thank you.
Thank
Alright.
you so much, doctor.
Okay.